To call a STEMI or not to call a STEMI, that is the question. If your patient is having a STEMI, you're going to need to see that in two contiguous leads. We have to start to memorize what leads look at what area of the heart so that we can know if we see an elevation in two of these leads, then we are concerned, super concerned. So if we're having a lateral wall MI, we're going to see elevations that would show us that that circumflex artery or maybe one of the diagonals of the LAD are blocked. So I would be looking for changes in one AVL, V5, or V6. If I were thinking that the patient was having an anterior or septal wall MI, remember this is the septum right here. So this is the area that we're talking about, the septal or the anterior being the front of the heart. I'm looking for changes in V1, V2, V3, or V4. If I'm having an inferior wall MI, and I want to point out that the reason that the right side of the heart is the inferior side is because the heart doesn't sit in the chest like this. The heart sits in the chest more like this, making this the inferior side. Your right side ends up becoming inferior, even though it's the right side of the heart. And so if I were thinking that the patient had an inferior MI happening, I'll be looking for something in leads 2, 3, or AVF. So continue to follow along. We have a whole ECG series. This is just a piece of that longer series. Let me know in the comments what questions you have. If you want some further resources, you can check the link in bio. Save this video for later so you can follow along with this series.